Welcome back to Healthy Living for Life. Joining me is Dr. Thomas Burbos, an ophthalmologist with Mountain View Eye Care. Welcome, Dr. Burbos.
Thank you.
Thank you for being here. So let's start out by talking about some of the normal things that happen to people's eyes as they age.
As we age, we have a couple things that we run into. Probably the first thing is the lack of focusing as we hit our 40s, requiring reading glasses or bifocals or such. Probably the next big event as we age is cataract production and the consequences of that.
Okay. So for those of us who have contacts or eyeglasses, how often should we go to the eye doctor?
Generally speaking, if you're in contacts, that's typically a yearly visit. Glasses depends on age and eye health and what other requirements might be needed to follow up that patient.
Okay. And for those of us who don't wear eyeglasses or contacts, is there a reason why we would need to go to the eye doctor every year or at all, or what would be the recommendation regarding that and why?
Sure. That's always a difficult situation when somebody doesn't have a need for glasses, and so there's no real impetus to come in and be seen. We've pushed towards having people get a baseline screening at 40.
Okay.
Some of those are for glaucoma checks, other types of eye problems that might be picked up early that may not be noticeable in their vision.
Okay. And then, let's talk a little bit about eye disease. If you could elaborate a little bit on what the most common eye diseases are, and what are the characteristics of each of those? And again, just the most common things that you might see.
Most likely the high prevalence of cataracts as we get older is probably the most devastating condition that we deal with in the eye world. And treatment for that, as we lose our vision and can't correct it with glasses or contacts, would require surgery to remove the cataract and replace it with an intraocular lens to restore vision. Another common one as we're seeing our population age is macular degeneration, and unfortunately the consequences of that with vision loss, especially central vision loss. The good news with that is treatments have been coming and been around for a while now that have really helped slow that disease progression. Unfortunately, we don't have a cure yet, and hopefully down the road that will come, but I think with the new technology and new treatment options we have, we've sure been able to help people from being able to say, I don't have much to do to, hey, I've got an option that can keep you going for a while longer with vision.
Of those things you just mentioned, would any of those be more hereditary than others?
So cataracts typically are not hereditary. There are some types of cataracts that are hereditary, but for the most part, they're a normal aging process. Macular degeneration can be hereditary. Unfortunately, it's a multifactorial disease, so other things such as smoking, which is a big component of the cause for macular degeneration, as well as being out in the sun without sunglasses, UV protection, especially as a young age, which prior was not pushed very hard to wear sunglasses when you're younger, but I think we've all learned that that's important. But also as we get older, wearing sunglasses and protecting our eyes from UV. Also, diet plays a role. A poor diet, unfortunately, also increases the risk of macular degeneration. So it does have a hereditary component where we do see families with multiple siblings having macular degeneration, but then we also see people that show up that don't have any genetic history. Some of that may be that predecessors didn't live long enough that we actually seen some of these diseases, however, so some of that we may find is genetic down the road as well.
So someone that does have a family history that comes into your office, would there be something you would counsel them about that? What would you tell them if that is present? If
it's macular degeneration, I think the big thing is getting regular eye exams. Also, if they do smoke, to encourage them to stop smoking. One thing we can do to decrease the risk of macular degeneration. But I think just regular follow-ups, because it's a disease if caught early, we have a much better chance of preserving vision and maintaining good vision for a longer period of time.
Very good. So back to cataracts, regarding cataracts. So I have heard that potentially women have a higher prevalence of cataracts than men. Is that true?
I don't think there's necessarily higher prevalence. I think we do more cataract surgery on females because of the simple fact they were more willing than men to come in and get checked and get things taken care of, where men are more willing to let things go a little longer before they get it taken care of. But prevalence-wise, they should be about even.
Okay. We were talking to Dr. Haskett earlier about total body health, and one of the things that comes to mind is high blood pressure. Can you tell us a little bit about how blood pressure affects your eye health and kind of what to look out for with that?
High blood pressure is a disease that unfortunately doesn't have much for symptoms, so unfortunately doesn't get always treated or taken care of appropriately. However, those that do have it, I think the key is getting it under control, because it can cause problems, especially in the retina of the eye. We can have problems with blood vessels that can get blocked up or break due to high blood pressure and cause lack of blood flow to a part of the eye, and we can lose vision. We can lose vision completely, or we can use sectors of vision, so we're missing parts of the visual field.
Okay. We have about a minute left, and one of the things that I think is really interesting is exercise and eye health. I mean, is there anything you could speak to, regarding normal exercise, keeping healthy, if that affects your eye health in a positive way?
Oh, it sure does. Exercise helps with controlling blood pressure. It helps with controlling your other vascular risk factors, such as cholesterol. So all that does help the eye, because the eye is a very vascular structure and is affected by those things. So exercise is extremely important to maintain, good weight, keep your blood pressure down, and keep your cholesterol levels under control. That's
great. Well, that's something for all of us to remember and keep in mind. It's a good motivator.
Yep.
If you have diabetes, you won't want to miss our next segment. Stay tuned.